Hello, welcome back to my YouTube channel. My name is Ioana and I am an interpreter, and this is video number 2, terminology that medical interpreter needs to know about diabetes. Okay, so we talk about what diabetes is: disproportional function of the hormone of the insulin that regulate the glucose in the blood and in the cells, and how the glucose get accepted by the cells in the muscle and use it as an energy. And if this is not happening in the right moment, in the right time, with the right quantity, this create a problems called diabetes. We have 4 types of diabetes. One of them is not considered as diabetes, but the first one, diabetes type 1, little or no insulin production in the body. About 10% of the people that have diabetes, they have type 1. It's also called juvenile. This kind of diabetes symptoms starts fatigue, sweating, hungry, nausea, vomiting, blurry vision, fast rate of the heart, sleepy, tired, and so on. This kind of diabetes, as is called juvenile, often get treated with diet therapy, exercise, and in some cases supplement of the diet hormones, and very or less rarely they use insulin injections or other type of pills that you can take in the body. Let's talk about diabetes type 2, which is the most common type of diabetes. This is the condition that affects the way the body produces glucose. Doesn't produce enough glucose or enough insulin, I'm sorry, and or create a resistance of the insulin. What this means? The resistance of insulin means that there is excessive glucose in the blood, which reduce the ability of the cells to absorb it and use. So the blood sugar, use the blood sugar for energy. So they have a higher risk of diabetes, or which means that they suffer. The resistance of the insulin, what this exactly mean? I'm gonna explain it in a simple way, guys. I read quite a lot about it, but there is also a lot of diagrams and graphic. Basically, when the glucose flow in the blood, there is the special cells that accept it through the blood flow. And sometimes because the glucose is higher, the density is higher, and the acceptance of the glucose from the cells, it's blocked or it doesn't function, it's not working. This create that the cells doesn't have energy, they don't have fuel, right? At the same time as the cells doesn't have energy and fuel, there is too much of glucose in the blood, which create a sensation of fatigueness. So the symptoms are thirst or frequent urination, hunger, fatigue, blurry vision, or no symptoms at all. They treat it here in America first with diet, exercise, then medicine, insulin. They put insulin pumps or insulin injections, or there is also pills, depend on the person. The number 3 is called gestational diabetes. This gestational diabetes happens when the women are pregnant in the last trimester of the pregnancy, and they believe that this is due to placental hormones that can create increasing of a blood sugar and so on. So normally what they do when this is present, they observe the baby very more frequently. They observe the mother and measure the blood sugar. Normally this type go by itself, but they believe the people that had, the ladies, women that had this gestational diabetes during the last trimester of the pregnancy are more common or under risk to develop diabetes type 2, so they observe them. And the diabetes type 4 is so-called pre-diabetes. So this means that your sugar is higher, is on the top level of the norm, but it's not high enough to be considered diabetes type 2. They believe that if you don't follow up a special diet, if you don't take care of it, you're very under risk within 10 years to develop diabetes type 2. Of course, the symptoms: Hubbard thirst, frequent urination, weight loss, and so on. Again, I repeat, the prediabetes is cured with diet and a specific, sometimes they take hormones and so on. People with prediabetes don't always take, don't make injections. Some of them take temporary, some pills, if you want to know. I will give you two terms now. Hypoglycemia, it's a low blood sugar. If you have a hypo, this means you swell, faint, and so on. I do have a low blood pressure, and sometimes this situation of hypoglycemia, when you feel like palpitation, your face is white, and you're suddenly feeling like you're gonna faint, and you need a sugar. This is me sometimes. I know exactly how that feels. And normally they treat that with eating very sugary, like juice or Coke, or the thing that helped me a lot is taking a spoon of sugar, even though it's terrible. It helps you to come back to your senses, basically. And hyperglycemia is high level of the sugar in the blood, which unfortunately you cannot cure as easy as with hypo. I'm gonna give you one last term related to diabetes, and the reason that it's called DKA, which means diabetic ketoacidosis. Coming from ketones, which is specific acid. The reason that I'm gonna talk about this guy, and I'm gonna just do it briefly and generally, and I will tell you why I'm talking about that. You don't need to know what is DKA, which means diabetic ketoacidosis. Sometimes doctors explain it. So what this means, this is a condition or situation in which the body produces excesses of a blood acid called ketones, which means not enough insulin in the body. Okay, these ketones, it's a diabetic ketoacidosis. The symptoms is pain in abdomen, thirst, hungry, all the symptoms. Nausea, including the nausea, vomiting, dizziness, blurry vision. Okay, so this is like a complication of diabetes type 2. Maybe complication is not exactly medically correct, but this is more serious type of diabetes, and I will tell you why. Because this diabetes ketoacidosis, just because the body produces this excess of a blood acid through these ketones, it can create complications, and this is the complications that you will work sometimes with. Even though the doctor's not gonna talk exactly what is it about, I will tell you. This create low potassium in the body, swelling or liquid in the brain or under the brain surfaces, fluid in the lungs called pulmonary edema. Okay, guys, talking about pulmonary edema, the doctors use that. They explain that it's just a fluid in the lungs, and what you're gonna do as an interpreter, there is a specific procedure related to pulmonary edema, and this procedure consists in putting the patient to sit, and this happens without anesthesia. So when they do it, it's very painful, and you as an interpreter have to be really suit, because you could literally feel the pain on the phone. If you do that procedure over the phone, it's really painful. So this procedure consists of that inserting a small catheter or tube through the back of the person or to the side to the lungs and taking the liquid out. This is really, really painful. And I, as an interpreter, you could feel the pain of the patient when you interpret. They really must stay still while they take the water of the livers. Another complication could be damage of the kidneys and other organs from the extra fluids in the body. The tests, normal test that they do is called HbA1c, which is mean hemoglobin A1c. Normally you're gonna know the test as A1c, and when they call from the lab test to give the result, they talk about A1c, which talk the level of the glucose in the last few months. So more glucose you have in the blood, more glucose you have in the urine, the A1c will be higher. There is a special range, and if it's above this range, it means the person has some pre-diabetes or complication of diabetes. So normally this A1c test, some of those tests for diabetes, they do it in the blood and they can see it in the urine because of high level of the sugars. But the high level of the sugars and enzymes on the urine test or also on the kidney test could mean kidney dysfunction. So, but A1c is specific that you could see the glucose level the last few months, and it's gonna tell you about the diabetes. Thank you guys for being here. That was a general terminology about 4 types of diabetes and what is, ketoacidosis. Diabetical ketoacidosis. Forgive me if I didn't pronounce it well, but you're gonna do the procedures related to the extra fluids in the lungs as an interpreter. Thank you for being here. Thank you for liking, sharing, subscribing. I am happy to make these videos for you guys. Please write a comment, smash the like button and write a comment below, and smash this bell to get notification when I create a new videos. Thank you for being here and have a wonderful day. Bye bye.